For weeks, we've stood here and told you about the worsening COVID situation in the state of Idaho. Sure, early this summer, we told you about COVID and it looking actually pretty promising. But now, we're in the darkest time our state has faced since COVID infections began in Idaho back in March of 2020. In recent months, weeks, and days, we've watched the Delta variant cause a surge to the like of which we had not seen here in the state. Then we watched part of the state going to crisis standards of care, and then a week ago, the entire state of Idaho going to operating under critical conditions. And even that dire declaration hasn't seemed to slow the outbreak or devastation that COVID is having on our healthcare systems and our community. As of Monday, 760 people are in Idaho's hospitals with COVID. 202 are in the ICU. Both of those are record highs. And those numbers are likely higher as not all hospitals have submitted their data yet this week. Now, these numbers we have told you over and over again, and we're going to continue to tell you about them, even though we may sound like a broken record. But why do we continue to tell you this? Well, we can't stress this enough. We are in a dire situation, and that continues to be a daily reality for our healthcare professionals and our healthcare system. But for the first time, we're seeing what it's like inside of our hospitals with a firsthand experience. Brian Holmes and photojournalist Kevin Esslinger were able to go inside the intensive care unit at Saint Alphonsus in Boise this morning. Brian, how would you describe the scene inside Saint Alphonsus?
Well, Joe, it was very powerful, to say the least, inside Saint Alphonsus today. And I kind of want to piggyback on some of the numbers you just threw out there. This morning, they were caring for 87, nearly 90 COVID patients here at Saint Alphonsus. In Nampa, 50% of their facility there is dealing with COVID patients. 50% of their facility are COVID patients in Nampa. They had 5 patients die of COVID here. Just yesterday, 5 of them. We were granted access to 3 departments here this morning. The emergency department, the ICU floor, and we also were into the intensive care unit as well. We wanted to see what the situation was like and talk to the people that have had to deal with this situation that they've never had to deal with at any time during this pandemic, but they're dealing with this today. We were taken to the emergency department, where some patients who would normally be kept for observation, they're being sent home shortly after receiving treatment, so they're not staying as long as they usually would. The normal wait time there, if you're going to be admitted to the hospital in the emergency department, we're told usually around 120 minutes. That's the longest. These days, a patient could wait a minimum of 4 hours and sometimes as long as 16 hours. And they also had to convert a storage room there in the emergency department. A storage room that now holds 6 patients, or has the potential to hold 6 patients. Then up on the 9th floor, which is normally an orthopedic floor, they've taken what is usually a rehab gymnasium, a rehab gym, a room where patients go to work out and rehab. Well, they can hold 6 COVID patients there. Yesterday, it was filled. They don't have any in there today, but likely, we were told, they'll be putting more patients in there soon. Meanwhile, in the ICU, where all 22 rooms are filled, the majority of them COVID patients, all of them unvaccinated. They're operating with 4 doctors each shift, where normally they would just have 2 doctors on staff. And that doesn't include the dozens of nurses and the other staff on hand for their 12-hour shifts. And that's not even the only ICU here at Saint Alphonsus. They've had to convert the cardiac ICU into a COVID ICU, and it has 10 rooms in it. All of them are filled with COVID patients. We were told after we were shown that room there, where they have now taken a day surgery, where they do outpatient surgery, they converted that to a potential ICU for COVID patients. And we were told after we saw that room today, they're likely going to start moving some patients into that room. Out of the 40 patients, a couple more numbers for you. Out of the 40 patients that are on that COVID floor, we were told 2 of them are vaccinated, just 2 out of the 40. Out of the 22 patients in the main ICU, 20 of them have been intubated and are on a ventilator. From those 3 departments today, the ER, the COVID floor that we talked about, and the ICU, we spoke to 3 doctors and a nurse. The nurse told us she lost a patient yesterday, one of the 5 that they lost here at Saint Alphonsus yesterday. They weren't on a ventilator, they weren't in the ICU, they were just on the regular COVID floor, but they had done all that they could there to save this patient, and it still wasn't enough. She told us today she can't even count how many patients she has lost in the 18 months that she has been here and serving during this pandemic. But yet she comes back every day because she knows that she is needed.
It's funny how you're able to figure out how you're going to cope with that, but I will say that yesterday was extremely difficult. You take your 60 seconds in the med room, you cry, you clean up your tears the best you can, and then you go back in because you know that that family needs you to be there.
Do you see the light at the end of the tunnel at all?
No,
You don't?
no. And that's heartbreaking for me to have to say. I did when I got my vaccine in December of 2020. That was my light at the end of the tunnel initially. But now I don't know where the end is, right? I will do this code blue, have to console a family member, because their loved one died from COVID, and then turn around and see that there's a big music festival, downtown, that people are going to large gatherings and not wearing their masks. And I get it. People feel like they want to keep living their lives, and we're not asking people to put everything on hold indefinitely, but we're in the biggest surge that we've ever experienced. This is the first time that our state has declared crisis standards of care, and many people in the community are going about their lives as if there's nothing different going on.
Joe, it's not all doom and gloom here at St. Alphonsus. There are many successes that they are celebrating, and it's worth celebrating. In fact, in a hallway by the employee entrance, they put up a tally of how many people they have saved and were able to send home during this pandemic. Today, that number was increased to 2,462. Doctors, nurses, support staff, they walk by that poster every day, and they can see the good work that they are doing and why it matters that they show up every day. Carrie Smith, that nurse that we spoke with, she says it's a privilege to be in that room with a patient who is passing from COVID and to be there with their family. Because again, as she said, she knows that she is needed, and that's where she needs to be. It matters because, as you heard, days like this can be pretty heavy. They can take their toll on the staff and the doctors, the nurses, everybody here at St. Alphonsus. Dr. McInerney told us that the hardest part coming to work isn't the physical toll, it isn't the emotional toll, it's worrying about whether or not she can have enough staff to care for all the patients that are here at the hospital. She is the ICU director, and that is her job, just one of her jobs, because she also makes rounds, and she also does everything else that comes with being in the ICU. And as I mentioned, it can be a heavy situation. 3 patients coded here at St. Alphonsus this morning while we were, well, not while we were here, one of them did while we were here. And it was impressive to see this staff respond the way that they did. Everybody focused on that room. The people that had to get in there got in there. There were no fewer than a dozen people working on this patient who was coding. What impressed me the most, Joe, I'll just leave you with this, is that the number of people that put their entire focus on that room at that time was impressive. There wasn't one person who wasn't occupied doing something else and caring for a patient that wasn't there willing to offer a hand, or at the very least, offer support for what was going on in that room. I thought I was ready for what I saw today, but we saw some stuff today, Joe, and it wasn't always pretty. But just know that the people inside this building and every one of these hospitals in the Treasure Valley and across the state are doing everything they can to not be in this situation. And every day we bring you these stories of how they're begging you to not put them in this situation. Some of them are unavoidable. We get that. They get that. But I don't know if we can say it enough, how much they really, really, really need help from outside these walls.
So Brian Holmes reporting from St. Alphonsus in Boise. Brian, I know we'll be hearing more from you in the coming days about what you saw in the ICU. Thank you for your report.
Yep.